I did a foundation year. My education, like I say, I didn't really do that well at college, and I thought if I started a degree program which is notoriously difficult and has a high dropout rate, I was going to crash and burn in my first year. So I did a foundation year first, which really helped me get used to being in the university. So my skills started to develop in this area here, and particularly patient handling, manual therapy techniques. We're fortunate enough to have an established chiropractor with us today, so he'll appreciate all of these things that you learn at undergraduate level. By the end of it all, I came out with a chiropractic degree 2011, and most people would just go straight into practice. You would go and work for an associate, or you might go and work on your own. You might open your own clinic, because you don't have to spend time working in a hospital or anything like that. When you graduate, you can go straight into practice and treat patients. So that was what everybody else I knew was doing. That's what I was all the way through the first 2 years planning on doing, and even towards the end I was planning on doing as well. While we were there, we got some really non-curricular extras. We were able to shadow orthopaedic surgeons at the Prince Charles Hospital in Merthyr Tydfil, and we also got to examine cadavers as part of our undergraduate course. So we were, even though we're a separate profession, we were encouraged to watch what the medical students were doing at Bristol, and also to be fortunate enough to be allowed into the operating room, scrubbed up, standing a yard away from the orthopaedic surgeons. Fantastic experience. But by my second year, I got to the point where I was talking to one of my lecturers, and I realised the profession, it's quite a young profession. They kept saying it's quite a young profession, but it should be more established. And a lot of the problems were not enough research being done in certain areas, and the medical association quite often would, I've not mentioned the name of the main aggressor, but had a problem with chiropractic, and he didn't really have something he'd written in a book. So there was all these problems going on, and the first thing I was told by my lecturer is nobody's doing research, and if they are, it's just recycled reviews, and there's nothing new being done. So I decided that I wanted to eventually, when I got into practice, do some of my own research as well. So even as early as the second year, I wanted to do that. We all got to do research as an undergraduate, which was a module rather than an actual full research project. So you're limited by time. It's not prioritised by the students at all, and it's not really forced on us by the lecturers at all. So it was it's changed now since I've been teaching and trying to force it onto the students postgraduate. It's changed. People are approaching their research projects with different ideas and thinking about publication opportunities even at undergraduate level now, so it has changed a bit. The big problem was there's no funding for it. Whatever you've got in your department you can use, or you can put money in yourself. There was no funding available, so the projects were limited and very frustrating. But by my final year, I was treating patients in my clinical year, decided I'm going to go into a practice and I'm going to do research when or if I get time, 5-10 years down the line. I was quite happy to do that. My undergraduate research experience was a condition called hypertension-associated hypoalgesia, something which I wasn't given as a title. I was told to just have a look at blood pressure and medications, and I discovered that people who are hypertensive have a lower perception of pain. So pain scales, if you do a scale from 0 to 10, people who have hypertension tend to report lower scores for the same conditions as people who are non-hypertensive. And then when the people are medicated, their pain scores go up. So it was suggesting that people who are hypertensive have hypoalgesia. And it was quite a weird phenomenon, nothing conclusive, and it had been very well discussed, but it hadn't been assessed within a pain clinic environment. So I spent a few weeks sat in a bunker, data mining, finding people who fit into either category, and it was still consistently, significantly different between people who were hypertensive and not. And then, yes, I was offered a job working with my brother. He's a chiropractor back in England. and had a nice associate position ready. And in typical accident-prone fashion, I was watching the royal wedding day, which turned into a royal wedding party day, which turned into me tripping as I was walking home and breaking my wrist, which meant I couldn't treat patients for 3 months, which meant I wasn't going to leave university on time. I was told I couldn't do my exams in time, which meant I had to give up the job that I had. Then, as I was in the couple of weeks deciding what I wanted to do, a KES MRes project was offered by the university. And I was more interested. I thought, I've not had an interview anywhere. My brother offered me a job without an interview, and I thought, it's going to be a really good experience to go and have an interview for a position. And I was just curious. The lead on the project was one of my lecturers. He lectures in neurology and pharmacology on the chiropractic degree, so I went to see him for a chat, and he said, I might as well come along for the interview. And then the more I read about KES and about the setup with the funding and the budget for travel, for equipment, and so on and so forth, by the time I came to the interview, I wasn't just curious, I wanted it. I really wanted the position. So I'd done a lot of research into the project before I got there, and very fortunate I did get it. There's a picture of, we had our photographs done around about the time I'd broken my arm, so you can just see a little green cast hiding under. I had a different coloured one every week, so proof that I did break my wrist.